Hello everyone, my name is Fabian Proft. I'm a rheumatologist and senior researcher working at the Charité University Hospital in Berlin, Germany. Currently, I'm the Young ASIS leader and the Young GRAPPA leader, and it's my pleasure today to speak with you about the importance of MRI for early diagnosis of axial psoriatic arthritis, abbreviated as axial PsA, with you. As we know, when we are going back in history, earlier on, axial involvement of psoriatic arthritis was often assumed when a patient with psoriasis or psoriatic arthritis complained about chronic back pain with inflammatory characteristics. And therefore, this was highly overestimated because we now know that even inflammatory back pain is not specific for inflammatory changes in the spine, but could also be induced by degenerative causes or other diseases. And when we were only collecting radiographs and we were saying that a patient with psoriasis or psoriatic arthritis who had radiographic evidence of structural changes in the sacroiliac joints, this underestimated the prevalence of axial psoriatic arthritis. Therefore, we really believe that implementing MRI of the whole spine and sacroiliac joints and to the early diagnostic setting for patients with the suspicion of axial psoriatic arthritis is of high importance. What we could recently show and was presented at this year's EULAR was that first, a very easy screening approach targeting dermatologists taking care of patients with skin psoriasis was feasible. And here, the dermatologists asked their patients, do you have chronic back pain that started before the age of 45 years? And if these patients answered both questions with yes and were not treated with a biologic or targeted synthetic DMARD, those patients were then referred to our center and had a clinical, laboratory, genetical, and imaging-based assessment of their symptoms. And here we could show that only in 15% of the patients, those patients really had axial psoriatic arthritis as the cause of their back pain. And we saw again that the clinical characteristics of inflammatory back pain is not specific for axial psoriatic arthritis, but can be easily caused by degenerative causes or any other diseases. Secondly, we presented the data from our gastric axial PsA cohort, where we included almost 100 patients with the clinical and imaging-based diagnosis of axial psoriatic arthritis. And what could be shown here that when compared to classic axial SPA, those patients with axial psoriatic arthritis were more often female. They were less likely to be HLA-B27 positive. They tend to be older as classical axial SPA patients. 3 out of 4 presented with inflammatory back pain characteristics. And what is the most striking fact was that almost 20% of those patients presented with an isolated spinal involvement seen by MRI. So no changes, structural or active changes in the sacroiliac joints, but only changes in the spine. So I think this is of high importance that we include a full spine and sacroiliac joints in those patients with the suspicion of axial psoriatic arthritis. These were my main take-home messages. Thank you for listening. It was a pleasure seeing you. Have a good day and bye-bye.